Uh, okay, guys. Hello, everyone. My name is Anna. I'm a director of outreach of Medical School Mentor. I'm also OBGYN Research Fellow at Yale. And today we are starting the Women in Medicine webinar, in which our goal is to bring women who are a reference in their specialties and who have impactful careers in research and medicine. So we are super excited to start today with Dr. Fallah. Dr. Fallah, she is currently a Gyn-Onc fellow at MD Anderson Center. She did her residency in OBGYN in Brigham and Women's Hospital, which is a program affiliated with Harvard Medical School. And she also did her medical school in Harvard. Throughout her career, she was nominee for Forbes Under 30 in healthcare, and she has many publications in cervical cancer, health equity, and medical education in global health. So, Dr. Fala, thank you so much for accepting the invitation. We are really excited to have you here.
Yeah, I'm super excited to be here and happy to answer any questions that people have. I'm happy to start with a brief overview of my career, whatever you guys think would be the most helpful.
Yeah, sure.
Yeah. So I guess I can share a little bit about my story so far. I went to UT Austin for undergrad. So that's kind of my Texas ties that I have. And during my time that I was there, I spent actually a month at MD Anderson Cancer Center, which is very funny because it's all come full circle for me. And while I was there, I spent time shadowing thoracic surgeons in the operating room in their clinics, on the wards, and got really excited about the possibility of being a surgeon one day. And then during that time, I also met a surgeon who was visiting from India who was learning different techniques for various surgeries to then take back to his colleagues and teach them at home. And up until that point, and I'm sure as many students are familiar, my understanding of global health, and particularly for surgical care, was this mission-based model. You know, you go in, you do a bunch of surgeries, and you leave. And that didn't always sit well with me, but I didn't know what alternatives there were. And so I was kind of inspired, I think, to get interested in this field of global surgery, but more from a sustainable lens. So I started just reading a bunch of papers about global surgery, and there weren't that many out at the time. There's a big publication that occurred in 2015, and so before that time, there wasn't a lot out there. So I just started contacting the authors of each of these papers to be like, hi, like I'm interested. Would any of you be willing to speak with me? And I was very fortunate that one or two people actually responded. And one of them was Dr. Mark Bernstein, who ended up being my mentor for my thesis project in undergrad. And what I was interested in is how we can help people build careers where they can sustainably be involved in global surgery efforts while maintaining kind of an academic practice, and then how we could better unify those efforts across different academic institutions. So after I finished that thesis, I ended up going to medical school. I was at Harvard for 4 years. And because of what I found in my thesis project, I wanted to do something with the results. And I met with a bunch of people at Harvard, including the Program for Global Surgery and Social Change, which I highly recommend if anyone's interested in global surgery. And they said actually where they think the most impact could be made is with students. So instead of trying to go all the way to the very top of leadership and make changes there, why don't we start from the bottom up, and kind of inspire the next generation of people to approach global surgery in this more sustainable way in a unified model. And that's where I decided to build the Global Surgery Student Alliance. And I know we're going to talk about that a little bit more with some of the questions, so I won't go into all the details. But after medical school, I thought I was going to be a general surgeon, and I did all my rotations, and suddenly I loved OBGYN. So I loved taking care of women, and I still loved surgery. I loved medicine. I was very passionate about kind of comprehensive care. So I applied for OBGYN residency and ended up staying at Harvard for 4 years to complete that residency. It was a little hard to maintain the global health interest while being a busy resident, but I had a month of elective time, and one of my other mentors, Dr. Tom Randall, took me with him to Rwanda and Uganda to do work in GYN oncology. And again, I won't go into all the details now, but that led to where I am here. So Dr. Randall knew my current mentor, Dr. Schmaler, and connected me with her. And I'm now in a GYN Oncology fellowship that's 4 years. The first 2 years are research, and these first 2 years, 2 years of research and 2 years clinical. And these first 2 years is entirely dedicated to global health. And it's a kind of a one-of-a-kind experience that I was able to build based on my past experience. So I feel very fortunate to have had all of these life experiences and to continue to do the work that I'm passionate about, because it's not easy to combine all of these interests. And I hope that gives you guys a little bit of a sense of my journey, and I'm happy to answer questions about kind of anything related to any of that, and kind of how you can build a career that you love and are passionate about.
Thank you so much for giving us that overview. It seems like you've had a really interesting career and very broad in terms of connections and outreach. Um, but I would like to kind of go to the start of it, and perhaps we can slowly build from that. So my first question, which I guess is something we like to ask everyone, is what first made you pursue a career in medicine?
Yeah, that's a great question. I wasn't someone who was like born saying I wanted to be a doctor. And I think you do hear that from some people, and that's fine too. For me, I was always interested in science and math. I always loved those topics. When I was in middle school, though, at one point I wanted to be a dolphin trainer. And so, like, way far off the path. But over time, I was like, maybe I'll be a researcher. And then I really love teaching people. So I was like, maybe I'll be a teacher, like a science or a math teacher. Um, and then I think as I got like more and more exposed to career opportunities, and I'll say my dad is also a surgeon, so I had a chance to see kind of what life as a physician looked like through his eyes. I wanted to explore more what it would mean to be a doctor. So in high school, I did a little bit of shadowing. I'll say shadowing in high school is hard to get, and it's not going to be a comprehensive experience, understandably, right? But I got enough exposure where I was like, this combines everything that I love. It allows me to do science. It allows me to teach people. It allows me to connect with people and kind of be there for their most like difficult moments in their life. And I'll say like a core thing about me is I'm a very empathetic person. That's like actually one of my most defining qualities. And I think that's a really important part of being a physician. And I think that's what like ultimately really drew me to it. So when I went to undergrad, I decided to be pre-med like upfront. And I think it was from that point onward that I was very clear that I wanted to be a doctor. But just to tell everyone else out there, like it's okay if it's not something that you know right away. I know a lot of really amazing physicians who did not know that that's what they wanted to do and had full careers before they switched to medical school. And then there's a lot of other fields in healthcare. There's things like PA school, being a nurse, a lot of other careers out there. So if you're interested in healthcare, but you're not sure if being a physician is the right thing for you, there's a lot of other options too.
Thank you for answering my question.
Yeah.
Thank you so much, Dr. Fallah. Given your nominations for Forbes 30 under 30, I wanted to ask, what immediate need or gap did you identify in the medical education landscape that compelled you to create such a significant national organization as the Global Surgery Student Alliance as well in your medical training?
Yeah, I think I felt like I had to work really hard to get resources to understand what it means to be involved in global health. And when I say in the right ways, I think there's no perfect right way to do global health or global surgery, but I felt like students didn't have a lot of guidance. And when I looked around me, especially in undergrad, there were people going on like medical missions, doing dental work, doing medical work. And I was like, but we're not trained. Like, I don't know that that's the right thing to be doing, no matter how fun it is, right? Like, it is really exciting when you're an undergraduate or when you're in medical school to just be hands-on and doing all these exciting things. But I just felt like there weren't a lot of resources out there for students. And I had to do a lot to like find the right people within the field of global surgery. And I just felt like there was a way to make all of this a lot easier. And so I think that's where it started, really. Like when I started at Harvard, I created a mini club that was just global surgery. Anyone who's interested in surgery and global health, like come join. And we thought the best way to kind of get the word out there was actually to host a conference. So the way GSSA started was actually very like natural and organic. We didn't start with a meeting that was like, we're creating a national organization. This is what we're going to do. It actually started with, we just want to host a conference. We want people to learn more. We want the resources that we have. You know, admittedly, Harvard has a very big global surgery presence. So we're like, let's share this with other people. And so we hosted the conference. We had like 200 people come in person. We had tons of people come online. And it allowed us to connect with students at medical schools across the country. And all of us had come from different places. So we knew friends who were all over. We sent all of them emails. We like heavily advertised. And by the end of it, we're like, well, what's next? Like we hosted a conference, but now we have all these interested people. So in the process of building all that, we decided we were going to form an organization. And that's how we built GSSA. And during the conference, we opened up the opportunity for students from other schools to build their own chapters. And that's kind of how it all started. And then over time, like friends of friends would reach out, people would contact us and say like, I want a chapter at my school. So we built a toolkit for them. So how do you know, what is global surgery? Like, what are some of the basic things you need to know? What are some of the papers you should read? We put together educational like materials for people. We eventually built like a mini online, we call it a curriculum, but just access to like various lectures on different topics in global surgery. We created a database of surgeons that people could reach out to. And we kind of tried to play the role of connector. How can we like help students get what they need in order to be involved in this field in all the right ways and get the mentorship that they need? Because the reality is at least for me, a lot of my journey is very dependent on the mentors that I've had. And I've been very fortunate to have people who have helped me along the way. So I just felt like it was really important that all students had access to that. And I think that's what really inspired the process. But it wasn't like overnight we made a decision. It happened over like a period of time. It's not easy, but still very fun and very rewarding in the end.
Thank you so much.
Yeah.
Of course, so it seems as though you were quite busy during medical school, and I'm sure it's really hard to manage both the demands of medical school as well as building an organization like that. So my follow-up question for you would be, what were some challenges that you faced in managing your schedule, building the organization, and still being a medical student, and how did you tackle them?
Yeah, it was a lot of work. And that was definitely a choice that I made. I would say there were times where this was taking upwards of like 20, 30 hours a week of my time, just sending emails, being on meetings, organizing things for the conference, organizing things afterwards. Our team met weekly, like if not more frequently than that. We were constantly texting. So it took up a lot of time. What I'll say is when you're very passionate about something, it doesn't feel like it's taking up time in a negative way. It feels energizing and it makes you really excited about the work that you're doing. So my advice when I talk to students is if something's taking up a lot of your time and it's draining your energy, then you need to reconsider whether that's like an important place to be spending your time. If it's taking up a lot of time and it's bringing you joy and it's like helping energize you to be able to accomplish all the other things in your life, then that's okay. I think the reality is it was exhausting, especially by the time I got to my clinical years. You know, you're in the hospital and then you're studying for exams and then you're also kind of on top of it doing all of this. And I think by the time I got to the end of medical school, I was tired. And I'll be very honest about that. But that's why you have to have really good teammates. And you also have to recognize like when it's time to like pass an organization on to like new leadership. So by the time I reached my third year of medical school, I had already involved another national co-chair who's now one of my best friends. We had gotten more people involved in the team to kind of help divvy up the work. We got more and more people who were invested and cared about the mission. And so by the time I really like moved on to residency, I served on the board of trustees, but fully like the helm of the organization was now in the hands of 2 other people. And so I do think it's really important to not try and take everything on by yourself, and to really like surround yourself with good people who like support you and support the mission of like the work that you're doing. And to this day, like I have to say, I've been really impressed that GSSA continues to hold on to the same values that we started with. We're continuing to grow. We're continuing to engage in activities. And, you know, we even have a WhatsApp group of all the former chairs who serve on the board of trustees, and we all help each other out. So I think, you know, as long as you can surround yourself by good people, that can allow you to share the burden, like especially when things get really hard. But it's important to recognize when you're tired and to take a step back too, because we can only sustain a certain level of energy for so long. And life, I think, comes in a lot of ebbs and flows. So you have to be really patient with yourself, right? Like you're not going to be able to be at 150% for like 6 years straight. You might be at 150% for a couple months, and then you kind of bring it back down, and life comes in cycles. So I always tell people, don't expect perfection from yourself constantly. That's just not feasible that way.
That is great advice to hear. So thank you so much.
And Dr. Fallah, could you tell us a little bit how was for you to choose OBGYN? Did you consider any other specialties other than general surgery, other than OBGYN? How was this process for you?
Yeah, it was torture to have to pick. I'll be honest. When I was in medical school, so I always thought I wanted to be a surgeon. I think that was very clear. And when I first came in, I wanted to be a thoracic surgeon actually because of the experiences that I had. But it was funny, I started learning like more details about kind of the lungs and the heart and how they worked. And I was like, this is cool, but it wasn't like bringing me tons of extra joy. So then I was kind of like, I'll just see what's out there. When I did my rotations, I ended up actually liking almost all of them. Like I really liked taking care of patients. And even like radiology, I found reasons to like it. Like maybe pathology was a little bit of a stretch, but psychiatry, like I enjoyed. And then my last 2 rotations were OBGYN and surgery. So I had to wait till like the very end. And OBGYN hit me by surprise. I think I loved that they provided such comprehensive care. Like one day you're on labor and delivery, one day you're in the clinic, the next day you're in the operating room. And even in the operating room, they were dealing with things like cancer, or they were dealing with things that were really benign. And I loved the surgeries that they were doing. I thought it was very interesting. They had open surgeries, laparoscopic, robotic. It was just a very comprehensive field for me. And then I think what really stuck was I remember, you know, when you're a medical student, you have a lot of kind of activities outside of what you do in the hospital. So you might say like, sorry, I have to leave early because I have a required like thing, you know, for medical school. And I remember being sad leaving, like every time I was like, oh, I really wish I could stay like a couple more hours. So that feeling stuck with me. And in particular, I had 3 days on GYN oncology. And I was like, these are just the coolest surgeons that I've met. Like they're so kind, they're so wonderful. Their patient population is amazing. They take such good care of them. And the surgeries were so interesting and like had the perfect balance of all the things I loved. So it kind of like stuck in the back of my mind. But then I did my general surgery rotation and I loved it too. And I was like, this is going to be so hard to pick. So I ended up doing a lot of sub-Is, and every medical student has a different experience. Like my husband did his rotations, did an anesthesia sub-I, fell in love, and that was it. I had to do like 5 sub-Is before I figured out what I wanted. So I did like medicine, gyn-onc, surg-onc, GI. I did maternal fetal medicine, so all sorts of things. And I went back and forth for a while, but I think ultimately I kind of listened to my gut and I was like, I just think I really love this field of GYN oncology, and I'm happy and like excited to do all the things for OBGYN residency to get there. And I'm really happy I picked this. Every step of the way, I have loved taking care of my patients and I felt very fulfilled. And what I'll tell people is if you're struggling to make a decision, I think at the end of the day, there's no wrong one. So I think if you like multiple fields, once you get started, you'll probably be very happy where you are. Sometimes if lifestyle is an option of the ones that you're interested in, it is okay to choose that because, as I'm sure we'll talk about in a little bit, life gets harder and harder as you get further and further along. And you'll realize that there's more to life than just being a doctor. So that's kind of my advice on how to approach it.
Oh, wow. It was a lot of advice.
Yeah.
And when you decided to go for OBGYN, what were the next steps that you decided to take to prep yourself for the match cycle? How was that?
Yeah, that's a great question. So, up until that point, I didn't really have a lot of OBGYN specific research. I think that's okay. I think people know that when you're in medical school, you're not going to walk in knowing exactly what you want to do, and that you're going to need time to figure things out. And sometimes decisions happen last minute because you happen to have a rotation 2 months before you apply for residency. You can't publish a paper in 2 months. Like, that's just not the reality of life. So I kind of stuck with why. So I prepared a personal statement and I had to explain my story. And I said, I I always wanted to be a surgeon. I didn't know what type exactly that was. And I always knew I wanted to do global health and global surgery. And then I explained, like, I went through my rotations and this is what I loved. And this is how I see my career moving forward. And I think when you apply for residency, the most critical thing that you can do is make sure that they know like what your future vision is for yourself in that field and why you care so much about going into that field. Those are, I think, the two most critical things. The rest of my application, I did have a lot of publications in global surgery. I had the work with GSSA, and I had like my global health interest. And so when they're looking at your application for residency, sure, it's nice to see like, if you apply into neurosurgery, they'll want to see that you have done some neurosurgery stuff. If you apply into plastics, they'll want to see that you've done plastic stuff. But for most fields, they're very flexible. And they understand that if you're capable of doing research, you're capable of doing activities and demonstrating leadership, it's okay if it's not perfectly fit within that exact field, as long as you can explain like what your future vision is for your career. So I just tried to make sure that I told my story really well. And I think that's something that carries forward every time you reapply and re-interview for a new next step in your career.
Thank you so much. And guys, a quick reminder, feel free to ask any questions, raise your hands, and Dr. Fallah will answer them.
Yeah.
Thank you so much again, Dr. Fallah. I wanted to ask regarding your experience, especially about your mentors and in mentorship. Could you describe a strategic approach to build a robust and diverse professional network, including identifying the several types and the strategy to keep it in the proper way?
Yeah. I think that's like a critical piece of how you can advance your career that people don't really teach you in medical school or in undergrad or really like at any point in your life. I think I was someone, and the way that this all started is I just cold emailed people. Like no one, when you're in undergrad, you don't really have like a ton of connections necessarily. So when I read a paper I really liked, I contacted the first author about it. And I was like, hey, or the corresponding author, because they should have contact information for you to be able to reach out to them. And I was like, hi, I read your paper. I think it's super interesting. This is who I am. I gave them like a small blurb. This is what I'm interested in. Can I please meet with you for 30 minutes or an hour to like talk about this? And I sent a lot of emails like that. And eventually one or two people responded. And I think that's my first piece of advice is don't be afraid to reach out to people. People are always happy to help. Sometimes they're very busy. So sometimes you might have to wait a few weeks to hear back. But don't be afraid to take that first step. I think that's my number one piece of advice. I think along the way is finding good people who have a similar interest to you and have a career that you like potentially want to emulate one day. So for me, I kind of mentioned a couple names, but like in undergrad, Dr. Bernstein, he was a neurosurgeon. I wasn't planning to be a neurosurgeon, and he knew that. But he knew I had a passion for global surgery, and that was something he was interested in too. And he paid for my time to be in Toronto and to do my research study. Like, it was really very generous, but all I did was email him and talk to him. And so I think preparing for those meetings so that you're ready to demonstrate again your vision for yourself and your future, if that impresses someone enough, they'll be willing to help you. And then over time, I always kept in touch with my mentors. So even once I moved on to medical school and moved on to residency, I would occasionally reach out to them and say, hey, I just wanted to give you an update. This is where I am in my life. This is what's going on. Thank you for everything that you did for me. I recently had a chance to reconnect with the thoracic surgeon that I worked with as an undergraduate because I was back at MD Anderson. And again, like over the years, I occasionally would send him an email. And so then people remember you that way. So you have to like kind of keep in touch. And then some of it, I'll admit, is a little bit of luck, like who you run into, who you meet, who you're connected with. But sometimes some of your current mentors can help you identify like new mentors in new places as you kind of progress through your career. But like Dr. Randall, for example, in residency, I was so lucky that I happened to go somewhere where there was someone who did GYN oncology and global health and could help like connect all of those dots for me. And then happened to know someone at a program that I was really interested in to get me to a place where I could spend like 2 full years doing global health, which is like not common within the field of GYN oncology. So I think know who you are, know what it is that you want, and be able to like demonstrate that. And don't be afraid to reach out to people and keep in contact with them over time. That's how you kind of slowly build that like group of people. And what I like to do, and part of the stuff we did with GSSA, was when a student would reach out to me, I'd be like, okay, great. I know someone who works here who is doing exactly what it is that you're interested in. Let me send an email and connect you. So you, over time, as you kind of move up in your career, can also help be that connector for other people and help students and trainees get mentorship. So that's my advice.
Thank you so much. It's
Yeah.
really helpful, and it's really a new vision on this part, especially if seen as a person that has already passed through it.
Yeah,
You're really
of course.
giving a really appreciative advices. Thank you so much.
Yeah.
So up until now, we've kind of been discussing your journey through medical school. And obviously, when you're in medical school, you're still interacting with patients and you have responsibilities, especially when you're leading a global surgery organization. But I was wondering, once you got to residency, how did those responsibilities change and how did you deal with that change? Because it's such a jump, right?
Yeah. I think the reality, and I tell everyone this, is once you go to residency, your primary objective is to learn how to be a good doctor in your field. So to get the clinical skills that you need to be good at your job. And the other activities are also important. You still have to do research. You still have to demonstrate leadership. But number one is always like, how am I going to make sure that I learn everything I need to learn in the time that I have? So for example, with GSSA, like I stepped down from a national leadership role because you cannot do 20, 30 hours a week of that and be a resident 80 hours a week. It's not feasible and it's not good for the organization either. But I decided to stay in contact and stay on the board of trustees. So I took on a different role and was able to kind of like stay involved still during that time. When there were opportunities to do things related to global health, I would take them, but it wasn't the same as in medical school where I was like, going to events all the time or meeting with people or like actively engaging in activities, and certainly not like traveling internationally, except for that like 1 month of designated time that I had for that activity. It was hard. I think, during my first 2 years of residency, I like lost a little bit of that like passion that I had before because I didn't have the time to stay in touch with like everything that I was doing before that. And it's hard to keep up with hobbies. It's hard to keep up with like the things that make you who you are. But eventually you get past that. So eventually you get like used to kind of your life as a resident and you figure out how to prioritize things. And I think by the time I got to third year and I had that 1 month of elective time, it brought a lot of that joy back. So as soon as I like traveled to Rwanda and Uganda, I was like, oh yes, this is like what I love. This is what I've been missing. This is exactly what I want to do. And it kind of reinvigorated that passion for me. And so you just have to pick and choose like how you spend your time and what's important to you. Also, to reassure people is there's still life after residency. And being, a physician is hard. Being a fellow is hard. Being an attending is hard. But you have a lot more ownership over your time. And so you can rejoin and kind of re-find like all of those passions that you had before. So you have more time to engage in your hobbies. You have more time really to rest. You have more time to do the research that you care about and other things. So it's okay to kind of dedicate your time in residency to becoming a good doctor, because it's a very specific time in your training that you only get one time. And then just remember that afterwards you can still come back to all the things you care about. But it's really important to try as hard as you can not to burn yourself out and to do too many things. And doing too many things at a medium level is not as good as doing a couple things really, really well, particularly in residency. So I think it's just something to keep in mind.
That is very true. They do say, what is that expression? You can be the master of all trades,
Yes.
or yeah. So we've been discussing a little bit about your work so far, right? But something that I would really like to kind of maybe establish or get an understanding of is, what is global surgery to you, and obviously global healthcare? Like, how does that differ from um just a normal practice?
Yeah. So I can start by kind of, it's a little hard to define like global health and global surgery these days because it takes on so many meanings, but it's the idea of health for all. Like I would say that's kind of like the all-encompassing definition. It's this idea that we're trying to raise the standard of care in an equitable way around the world, including internationally, but also locally. So it's very important to remember that global health is not just, oh, I'm traveling to like a different continent where there's a country that's low resource settings. For me, like also here in Texas, we have some of the highest rates of cervical cancer like in the world in Texas. So I think it's important to remember that global is local, and that really like ultimately we're trying to equitably improve the standard of healthcare for everyone around the world. For surgery, that specifically means surgery, OBGYN and anesthesia care, again, in an all-encompassing fashion, because global surgery and the surgical aspect of global health hasn't really been a big part of the agenda for a very long time. And so the field of global surgery specifically has tried to kind of raise the voices of those who need surgical care, which is a large number of people around the world. What I will say is having a career in global health looks very different for different people. For me, I've always been really passionate about education and capacity building. So the way that I envision my career in the future is not that I'm going to spend, 6 months at a time abroad providing like healthcare in a low resource setting, but more so that I'm going to build relationships with people in various settings around the world and locally to help build their capacity to increase the standard of healthcare wherever they are with the resources that they have available. And I'm happy to share a little bit more about like some of the work that we're currently doing, but in GYN oncology specifically, the International Gyn Cancer Society has fellowship programs across, I think now, 18 different countries. So these are countries that didn't have GYN oncology specialists before. So women who had cervical cancer or ovarian cancer or endometrial cancer were not getting kind of the standard of care treatment that they should be receiving. And were oftentimes even getting surgical care that wasn't necessarily like appropriate or based on guidelines. So this program has built fellowship programs in these various settings where there's local mentorship happening on a day-to-day basis, and then international mentors who come several times a year to provide like on-the-ground education with like weekly or bi-weekly meetings where they discuss cases and like help like build their academic background in global surgery. So in GYN oncology. So I think there's a lot of different models. There are other people who say, like, I want to travel for 6 months at a time and like be in another setting and kind of do a lot of the capacity building on the ground that way. And that's okay too. There are other people who are involved in global health more from a research standpoint, where they do research projects with partners in low resource settings, or are doing policy work with the WHO. So it can look like a lot of different things, and it just depends on like what you're passionate about.
Thank you so much. I can definitely feel how inspired and passionate you are about this.
Yeah, I'm still excited about it now, so that's a good sign that I'll be able to keep going, hopefully for many years. We'll see.
Thank you again. Since among our public we have a large number of international students from all over the world, I wanted to ask, as you two have proficiency in other languages aside from English, how has your languages and culture skills shaped your approach to patient care?
That's a really great question. I think there's a part of my background that I can probably share here that's not so obvious from like online or anything that you'd probably find about me. So both of my parents are from Iran. So they emigrated to the US when they were around 17 or 18 years old during the Iranian Revolution. And so their culture and like their lives like very much shape like my view of my life. I was born here. I grew up here. I do speak Farsi because of my parents. I speak a little bit of Spanish because of what I learned in school, though I wouldn't call myself fluent yet. And my dad actually joined the US military. And so that's how he got dental school paid for. And he actually stayed for many years. So we moved around my whole life. So I actually spent 2 years in South Korea when I was a kid, and have also lived in various parts of the United States. And I think all of those experiences have very much informed like who I am and how I view the world. I think being at a young age and living in another country and then traveling to various areas in that part of the world, I saw a lot of things that not a lot of kids like just living in the same place in the United States would see like on a day-to-day basis. And the other thing that's informed a lot of who I am and how I care for my patients is my religion. So I'm Baha'i. It's not a religion everyone's heard about before, but it's an independent world religion that started about 200 years ago in Iran. And the main tenets of the Baha'i faith are unity of mankind, elimination of prejudice, and equality of women and men. And so all of those things kind of inform who I am as a person and why I care so much about raising the standard of care for everyone around the world, and why just doing things for myself is like not an option and not kind of how I view the world. So hopefully that gives you a little bit of background, but I think for people who have had diverse life experiences, it kind of feeds into who you are and how you care for people and how you care about those, not just in your immediate vicinity, but people around the world. I think the more you travel and the more that you see, I think it becomes harder and harder to, view your immediate vicinity as the only thing that matters, because you start to realize that the world's actually not that big of a place, and that there's people all around the world that matter and that you care for and that you want to be able to help and serve.
Thank you so much for telling us about it. It's really important. Also, the fact that there are some increment in international students wanting to applying to to foreign countries, especially as periods of the formations is really crucial for them. Thank you.
Yeah. And it's, I know the application process and things for international students can be really challenging. You know, I have several friends who have gone through it, and particularly through like the global surgery work that I've seen. It's a hard process. It's not fair that it's hard that way. But I think the most important things that you can do are still the same things. The same advice that I give everyone is to do the things that mean a lot to you. Everyone still has to get good grades. They still have to get good scores on things. That's still important. And I don't want to brush over that because that was a big part of what I did in undergrad and med school. You still have to work very hard. But also like finding kind of the things that matter to you most will allow you to like really effectively spend your time. And then when it comes time to apply for medical school or for residency, being able to demonstrate that is going to carry you very far. But I totally recognize the process for international students is so much harder. And it's not fair because they're not actually any less qualified. And I think everyone knows that. It's just that we have a system that's very kind of biased in our country right now.
Yeah, this whole process can be really challenging. And most of our public, they are from foreign countries. So I think it's really nice for them to hear that, you know, it's possible to achieve. And thank you so much for saying that. And now talking a little bit about your fellowship. Listening to you, you talk in such a passionate way about Gynonc. And I was wondering, what was your biggest challenge in this specialty? How did you move forward with that?
Yeah. So GYN oncology is a very unique specialty for many reasons. So first, GYN oncologists are surgeons, but they don't do general surgery training. GYN oncologists are also people who provide chemotherapy. They don't do internal medicine training. And so it's a very unique field that comes at the like intersection of like OBGYN, medicine, surgery, like everything all together. And we're kind of the only like oncologists that provide both surgery and chemotherapy. It's a very unique like field to be in. So it's a lot to learn. It's a lot. And that's why our fellowship is a little longer than some of the other ones. I love that it's so comprehensive. I think for me, the idea that like once we have a patient, they're like our patient really for the rest of their lives. And unfortunately, sometimes those lives are short and sometimes those lives are very long. But we're kind of like their main doctor throughout that entire duration of time. So we're not having to pass them back and forth between various people. And any GYN oncologist you meet like owns their patients. We call it like patient ownership. We own them like as if, you know, they're the most important thing to us in the world. And I think for someone like me who cares a lot about, you know, a very passionate person, very like emotive person. And I think being able to connect with your patients in that way is very special. I think the surgeries that we do are super cool. Like we do, I'll say the majority of what we do is the pelvic organs. So we'll operate on the uterus, the tubes, the ovaries, the cervix. But we also operate on the bowel. You'll meet GYN oncologists who remove spleens. We do other types of unique surgeries to kind of remove cancer for patients. So it gives you kind of like a really broad sense of operating in the abdomen, which for me was, I thought, very exciting and exhilarating, rather than being kind of forced into doing like the same 2 or 3 surgeries like every single day. And every patient is different too. So there's a lot of kind of unique aspects to that. And then from a global health standpoint, I think I got really lucky. I didn't know about the International Gyn Cancer Society until I dug deeper into it during residency. But the model that they have going currently for building capacity for GYN oncology is like exactly the kind of thing that I love and am interested in. And so everything just worked perfectly for me to like want to go into this field. And one of the biggest problems right now around the world is cervical cancer for women. It is incredibly prevalent. It's more than 95% of deaths occur in low resource settings. Most cases are occurring in low resource settings. And as many of you guys know, and people in medicine know, it's a preventable disease, but we aren't doing a good job preventing it. So there's a lot of places where you can make a huge impact as a GYN oncologist in global health and in global surgery. So for me, all of those things kind of came together and it was like a perfect blend of all the things that I wanted. So that's kind of why I chose the field. And for people who don't know what it is, now you know, and it's something that you can consider.
Thank you so much. Listening to you talk about this, it's give you know a warmth in the heart. It's seems like an amazing specialty. Thank you so much for
Yeah.
that.
Yeah, of course.
Yeah, it's definitely very informative. I will admit that I didn't know that there were so many branches of
Yeah.
OBGYN. However, there is one thing that I think really does come up a lot with OBGYN, which is how difficult it can be for women to access healthcare.
Mhm.
And so I was wondering what your perception of that is, what challenges you might have faced, and how we as medical students or future doctors can better advocate for our patients.
Yeah. It's one of the hardest parts, I think, of being an OBGYN for sure. And in particular, depending on where you live. So I was very fortunate that I did my residency training in Boston. And Massachusetts as a state is a very liberal state. So they have very liberal laws on what type of healthcare women can access. That includes basic things like birth control. That also includes abortion care, which I know is a very um, important topic to discuss. So I got trained in everything. And I think that was like really, really important for me. And it's actually determining right now where a lot of OBGYN prospective applicants apply for residency because they all want to be able to get that training. And also, it's very hard when someone comes to you and they need help and you can't help them. Um, in Texas, things are different. They're very challenging. I haven't provided obstetric care in Texas, so um, I haven't had the direct experience of working with patients in that way in this state. Um, but unfortunately, I think the country and like parts of the world are moving backwards. Um, I think all of this stems from this idea that women and men are not equal, unfortunately. And so women are oftentimes treated as like second-rate citizens, and their healthcare is not as important as that of men's. And so all of these things kind of come together, and you see them play out in the various laws that end up being passed wherever you are. I would say our country is moving backwards compared to most around the world. Most countries around the world are actually liberalizing women's access to care, which is very reassuring and very like great to see, except for when you live in the United States. And I think it can be very disheartening. What I'll say is it's important now more than ever for like good people to go into OBGYN to make sure that they do everything they can for women to get the care that they need. A lot of the care that we provide, there's a lot of misconceptions about like what OBGYNs do and why we do what we do. And people who are creating these laws don't have a medical understanding of why like certain things are necessary in order to save someone's life, in order to give them options to live their life. It's a very complex topic, so it's like hard to answer directly, but what I would say is if you're passionate about caring for women, like we need more people like that in the field to make sure that people get what they need. And there are ways to work around laws. Um, there's ways to help people get the care that they need, but it can be more challenging in certain settings compared to others. Yeah.
Thank you for sharing that.
Yeah.
So can you tell us a little bit about your experience traveling to, you traveled to a lot of different countries, and I wanted to know how this shaped your practice now and how this experience enrich your practice now.
Yeah, that's a great question. I didn't do a lot of international travel other than like living in Korea and like traveling with my family. It wasn't until my first year of medical school. And that was because I had like this really strong feeling that until I had some kind of knowledge or background, it didn't make sense for me to like travel internationally and provide medical care or be involved in medical care. So the first place I went to as a student was Rwanda. I went there for 3 weeks as a medical student just to observe. So I was very like cautious, like not to scrub into OR cases and not to like provide care in the clinics, but really just to learn. And so I was in kind of the trauma surgery wards and just like the general surgery ward areas. And then when I was in residency, I went back to Rwanda, but this time for GYN oncology purposes, and Uganda, where we were doing some cervical cancer research. And then now in fellowship, I've had a chance to go to Mozambique, to Indonesia. I'm going to Kenya, hopefully next week, and a couple other places as well. And I think being able to understand like what healthcare systems look like in different settings really kind of broadens your world perspective. I also think, very truthfully, like seeing all the challenges that people face in various parts of the world gives you a lot of humility and a lot of understanding and caring for patients here in the United States who are also experiencing difficulty with accessing resources and accessing care. One of the hospitals that I work at, so I work at MD Anderson, but I also work at a county hospital called Lyndon B. Johnson Hospital. And over there, like the patients are coming in with advanced stage cervical cancer because they didn't have healthcare insurance to be able to come into the doctor sooner, or they didn't have the funds to see a primary care doctor for many years, so no one ever really did a checkup on them. And I think like all of these things really change the way that you approach patient care, and also change the way you view the resources you have available to you in your hospital, and also make you more mindful of how you use those resources to like care for your patients. So I think for me, like my favorite patients to take care of are the ones who like need more of that support in accessing resources and getting the care that they need because the system didn't really take care of them. And so I think like with all my travels, it's really kind of broadened my perspective of like how fortunate we are here in the United States with what we have, and how we need to be really careful not to like overuse and be wasteful, because I don't know, there's a lot more that we can be doing, and it's not equitable, not between us and other countries, but not even within our own country, and really not even within the own city that I live in.
Yeah, thank you so much for answering that. And out of curiosity, when you go and you travel to these places, usually other doctors come. Usually, do you bring material, or they have like already material there? How does that work?
Yeah. So in my current work, a lot of our collaborations are with ministries of health directly. So we work with ministries of health and have kind of like a memorandum of understanding between our hospital and them. And a lot of our work is in the cervical cancer prevention and treatment space. So sometimes we'll bring equipment to do training. So how to screen for cervical cancer, how to follow up someone who screens positive, how to treat someone who has a precancerous lesion. So we do a lot of like educational based activities on that. We also do a lot of research right now. So in Mozambique, we have NIH funded studies that we're working with a local team there, looking at how we can treat women with HIV who have cervical precancer and the best ways to treat those patients. And so over time, those funds have helped kind of purchase certain equipment to like allow them to proceed with the study and provide care for those patients. When I was in Rwanda and Uganda for the fellowship, we don't really bring any resources with us. We're working with the resources that are available locally, in part because anytime you bring new equipment to a setting, as soon as that equipment breaks, it's no longer useful, and you don't have the infrastructure to like continue to maintain that equipment. So you have to be very thoughtful about what you give, what you bring, what you donate, what that means for that setting, and how like useful it is. For our cervical cancer work, we have portable, we call them LEAP machines. LEAP is loop electrosurgical excision procedure. It's a device that helps remove a piece of the cervix to remove precancerous lesions, and then thermal ablation, which can burn the outer portion of the cervix, again, to kind of help get rid of precancerous lesions. Those devices are portable and battery operated and are very like low complexity. And so those devices we've brought to kind of like help in certain settings. But you have to be very thoughtful. Like if you bring like a laparoscopic surgery equipment and it breaks, then it's not useful anymore. So you just have to be very thoughtful about what equipment you introduce. And you have to work with hospital administration to make sure that like this is equipment they want, that they think is useful, and that they have the ability to kind of troubleshoot it if things go wrong. Yeah.
Thank you so much. This is amazing job. Thank you for answering.
No problem.
So we are almost at time, but I did have one last question that I really wanted to ask you.
Okay.
A lot of our network really centers itself around mentorship and how future students can grow and step into the shoes of amazing people such as you. So I had a question, which was, I guess, centered around future or medical students or current medical students who might be inspired by your journey and wish to kind of have a similar path, what would be the most important piece of advice you could give them?
Well, that's hard. Oh, I think what I would say is it's very easy to look at people who are 10 years ahead of you and think like, oh my God, I have no idea how to get there. The reality is 10 years ago, I had no idea I was going to be like sitting where I am today. So follow the things that you love and keep doing them. And eventually over time, you will find that the universe will give back and you will identify like mentors and people who are going to help you grow. I like my mentors right now, I look at them and I'm like, there's no way. Like, I have no idea what the like next step is to like get to where they are. You know, these are people who are like 20, 30 years into their career. But you just have to remind yourself like every little step forward matters. So right now, if you're in undergrad, try not to think about like, okay, I'm going to be like president of a hospital in 30 years. Try to think about, okay, my next goal is that I'm really excited to get to medical school. So like, what are the things that I can do to achieve that goal? If you're in medical school, that goal might be, I want to be, you know, a neurosurgery resident. What are the things I need to do to get there? Try to break down the big goals into smaller steps and remember that every single person that's kind of accomplished a lot in their life, they didn't do it alone. They had help, they had good people around them, and it all happened in little incremental steps. So try really hard not to get too bogged down in like, I want to be like this person one day, and I don't know how that's going to happen, so I might as well give up now. Try really hard to focus on all the little steps along the way. Every little bit of progress matters, and you'll be surprised, like the opportunities that will come to you and the way like things will happen. And then the final thing I'll say is say yes to opportunities that are exciting to you. So if an opportunity comes by, like say yes, do those things, reach out to the people, send that email that you were nervous to send. You just like never know like what will happen and where things will take you. Yeah.
Thank you. That is amazing advice. Thank you.
Dr. Fallah, thank you so much for accepting our invitation. It was an inspiring talk. I can't say how much I felt inspired listening to you, truly. So thank you so much. And for those who didn't have the chance to attend this webinar, we recorded and we're gonna post on YouTube. So feel free to share with friends. And that's it. Thank you so much.
Thank you guys for having me. You know, you guys are doing great things. You're really helping a lot of students by asking all of these questions, and best of luck in your own careers.
Thank you so much.
Thank you very much.
Bye, everybody.